Great. I think we do have everyone. Welcome to Baltimore County's Business Forum. This is number 3 for Baltimore County's COVID and Beyond Economic Development webinar, hosted by our County Executive, Johnny Oshefsky. We're starting our third webinar. The first was focused on small business while we were looking at the PPP program and trying to get our very smallest businesses counseled into that program at the federal level. Our second webinar was aimed at displaced workers, of which we have over 94,000 of our citizens here in Baltimore County on unemployment, and it was focused on getting them resources. But today we switch to getting back to business safely, and that is the topic at hand today. We've assembled a group of folks to bring you valuable guidance and a game plan for businesses and employers who are preparing to come back with their customers and employees in a phased reopening here in Maryland. So we are joined today by our County Executive, Johnny Oshefsky, and his Deputy Administrative Officer, Drew Vetter, who will give us an update on the situation. But we've also assembled quite a panel of experts to talk to us about public health, hands-on best practices for keeping your businesses and workplaces safe. So I'd like to begin by just first saying hello to our different representatives here. I think we have Dr. Sohail Carney from Baltimore County Department of Health. Good morning, Dr. Carney.
Good afternoon.
Good afternoon. I'm sorry. We have Brian Sansoni from the American Cleaning Institute. Good afternoon, Brian.
Good afternoon. Thanks for having us.
Okay. We have Lucia Mullen, an analyst from Johns Hopkins Center for Health Security, doing a lot of work here in COVID. Hi, Lucia.
Hi, good afternoon.
We have Emily Brophy, the Senior General Manager at Towson Town Center, a Brookfield property.
Hi, how are you? Happy to be here.
Thank you. We have Chef Brian Boston from Milton Inn, owner of the Inn, but also chairman of the board of the Restaurant Association of Maryland. Hello, Brian. Do we still have Brian online? We might have him on mute. And we have Kelly Carter of the Liberty Road Business Association, the executive director, and the owner of Grind and Wine Restaurant out in Randallstown as well. Hey, Kelly.
Good morning.
And with the county, we also have Mike Moeller, our liquor board chief administrator, to talk about what's happening on the restaurant and bar and liquor goods. Hey, Mike, how are you?
Good afternoon, Will.
Great. I think we're going to get to a deeper introduction from all of our panelists and get to some very specific questions. We've had a series of questions coming in from our public as we announced this webinar, as always, and we are fielding live questions throughout. So you can send those questions in to the email address that was provided, our business help email address. Todd Dolbin's on the other end of that line, feeding them into our panel. So I'll bring those into our panelists. But first, I'd like to ask our county executive to kick off. County executive has been meeting with quite a few people in our local economy, our major employers, our chambers, our industry groups, his economic development board, restaurant and bar associations. Just the other day, we met with all of the tourism and arts industry, but today is really about getting ourselves back open. And this is all in a part of the different efforts he's leading throughout the county, from public health to food safety and food access, and just operating a gigantic government in this environment. So if our county executive could open up with remarks about getting back to business. I know you've made several statements in the past 24 hours about how we're going to be folding in, phasing in with the governor's state of Maryland phasing. So, Mr. County Executive. I'm not hearing our county executive. So Drew, what I may ask to do while he's coming onto the line, I might switch over to the work that the business group is doing specifically, and then we'll come back to our county executive as he joins.
Well, I think the county executive is having some tech issues this afternoon. So thanks for the introduction. We might have to improvise a little bit here as we figure that out. So I'll go ahead and get right into it, and hopefully we can get that worked out. But again, My name is Drew Vetter. I'm the Deputy Administrative Officer for County Executive Olszewski, which means I help the County Executive manage a number of the county departments, including our public safety departments, police, fire, corrections, and our economic development and business-facing departments. And what I wanted to do this afternoon was give a sense of where we are in terms of the state and county executive orders on business operating status, and hopefully provide some clarity as to where we are and how we're making decisions, including giving a sense of the metrics the county is tracking to guide our decision making going forward. So where are we now?
Hey, hello. Hey, Drew.
Great. I'll pause there. Sounds like we have the county executive.
I think I was on mute and my WebEx wasn't working, so I had to dial in. My apologies, everyone, but thank you, Will, for kicking things off. Drew, thanks for getting started. We're going to kick things over back to you in a second. I wanted to just take a moment before we get too far into today's webinar to thank all the panelists for sharing their knowledge and experience with us. We have both national experts and local small business owners, but it's very valuable for us to hear your advice and also for you sharing with those who are listening today and the recording. So I think Drew was getting into some of the metrics that we're working on as we respond to this. We've been pretty consistent in working with public health experts and knowing that some of our key indicators aligned with the state's indicators are expanded testing, increased access to personal protective equipment, particularly for healthcare facilities, nursing homes, and our frontline workers, contact tracing, as well as the ability to self-isolate and quarantine. We have been making significant progress in Baltimore County, having announced just this week an outreach for PPE in nursing homes. Even though they're state-owned and regulated, we're stepping up and meeting that need. We are significantly expanding testing capacity. Just yesterday, we had our first non-appointment, non-doctor order testing site where we did almost 1,000 tests at the state fairgrounds. Baltimore County is ahead of the state, which is actually unfortunately lagged behind in terms of testing rates and positivity rates. But we are making significant progress on our testing capacity. And so in light of that, and the fact that we have a contact tracer program stood up in partnership with the Community College of Baltimore County, and that we are in the process of hiring almost 70 additional contact tracers, we were in a much better place to move further towards phase one of the reopening. And so yesterday we also announced that with the limitation of capacity, we are effectively aligned with the governor and the state on phase one of the ordering reopening, which includes retail stores, barbershops, and hair salons. And then so effectively, absent the restriction in terms of capacity, we are anything that's closed still is pursuant to state order. And so we're going to continue to move forward to protect our residents, to partner with our business to provide that gear, the testing, the tracing, so that we can continue to move towards a safe reopening in a way that balances the economic needs along with the needs to keep our residents safe. Obviously, small business, Main Street, and entrepreneurship are critical areas. They were among the hardest hit, and most are really damaged already. And so we are trying all that we can to support all of our businesses, but especially our small business. We are doing a lot of step here. We have a lot of state and federal programs, but Drew Vetter, who you just heard from, will be describing in a moment some of the small business grant programs where we're trying to close the gaps here in Baltimore County. We're also staying in close contact with all of our business sectors, hospitality, manufacturers, college farmers, and the like, and we're doing all that we can to help them. As Will mentioned, we're also talking to our advisory boards and major employers. So we're actively working through Will's Department of Economic and Workforce Development to answer business inquiries, help workers get access to resources, and we're also happy to keep working with employers who are still hiring to promote job opportunities that are out there. So as I mentioned, Drew Vetter is leading our Business Assistance and Economic Recovery Committee, trying to make sure that we have both short, mid, and long-term solutions. And so with that, I'm going to turn things over back to Drew instead of introducing it to him, who chairs the group, to tell them a little bit more about the strategies that they've done to date, things they're thinking about, and where we can go from there. Again, I want to thank you all for joining, and I hope that you find this time helpful and productive.
Thank you, Mr. County Executive. As the county executive mentioned, we've established an internal working group on business assistance and economic recovery. And the most important thing that we wanted to mention was the emergency relief grant program that we established. We created a new $10 million grant program that provides grants of up to $15,000 per small business to assist with operating costs like payroll, rent, and other operational costs. We opened up the application period for that last Monday, and we've received applications that account for about half of that money. So we've been happy with the response, but we definitely still have funding available for any businesses that are listening. So we highly encourage you to visit the county's website to get all of the criteria and application information for that program. And please submit an application if you apply, if you qualify. Kind of jumping back to where I was before, and I think relevant to the theme for today about getting back to business safely. I wanted to try and summarize where the county is relative to the state, what the different executive orders mean, and how the county is making decisions moving forward. So where are we right now? The executive orders of Governor Hogan have really dictated the status of public gatherings and business closures up to this point. This changed somewhat last week with Governor Hogan's most recent executive order, which allowed certain parts of the Maryland economy to reopen, but really left it up to local jurisdictions whether we would be more restrictive than the state executive order. And stated differently, the county cannot be less restrictive than the state, but we can be more restrictive. And in my comments to follow, I'll point out a few areas where the county has chosen to be slightly more restrictive than the state. But like the county executive said, anything that is still required to be closed completely at this point is because of the rules that are in place at the state level. So what is the state allowed to reopen so far? Generally speaking, gatherings of more than 10 persons are still prohibited. Religious facilities were allowed to open to the public, provided, however, that the total number of persons permitted inside at any one time shall not exceed 50% of maximum allowed occupancy. Similar rule for retail establishments, which are allowed to be open at that 50% of maximum occupancy. The only personal services that have been allowed to reopen are beauty salons, but only to provide hair services and barbershops. Malls are generally still closed, and we have Emily Brophy from Towson Mall with us today. We'll hear from Emily in a few minutes. But malls are still generally closed with a couple exceptions. Retail establishments attached to enclosed malls can be open under certain restrictions. And then local governments are permitted to provide access to retail establishments inside of malls that primarily sell things like groceries or pharmacy products or other types of essential goods or services. Manufacturing businesses and facilities in the state have been allowed to reopen, but the state executive order has continued to maintain closure of theaters, fitness centers, and restaurants and bars, except for what we've all become very familiar with, I'm sure, which is carry out, drive-through, and delivery from restaurants. Just a side note about restaurants and bars, they're still only authorized for the carry out, drive-through, and delivery, but we are preparing for outdoor dining to be permitted at the state level at some point. We have Brian Boston from the Restaurant Association on the call, as well as Mike Moeller representing the Baltimore County Liquor Board. And going back to last week, we've been preparing to be ready when that gets authorized, so that our restaurants are able to provide service in an outdoor setting as soon as that's allowable under the state. So what have we done in the county? The county continues to enforce the state prohibition on gatherings of more than 10 persons, but we are slightly more restrictive than the state executive order in a couple areas. And I just want to be clear that in making decisions on whether to be more restrictive than the state executive order, we've been guided by the advice of our county health officer, and based on principles of public health and the county's current preparedness to prevent, detect, and mitigate outbreaks of COVID-19. We recognize that protecting our population based on public health principles has to be balanced against the economic well-being of county residents and the business community. And we know that economic well-being is directly tied to the ability to reopen certain parts of the local economy. So County Executive Olszewski issued updated guidance just yesterday, which went into effect this morning, that allowed retail stores to reopen subject to the state's capacity restrictions, but in any event, with no more than 10 people inside at a given time. Beauty salons and barbershops in the county are open to the public again, but only to provide hair services. So similar to the state rule there, and subject to the 10-person limit. And then religious facilities are permitted to hold services and ceremonies indoor, again with the 10-person requirement. Services can be held outdoors with the 10-person limit. And the 10-person gathering limit does not apply to gatherings conducted in a drive-in fashion where participants do not gather outside of their cars. And we've seen some interesting models for those types of services popping up in places throughout the country. So what metrics are the county's reopening decisions being driven by? I just kind of described where we are today, but those decisions are going to be constantly evaluated and modified as the circumstances dictate. So modifications to those decisions are going to be based on data and metrics, with the safety of our residents as the most important factor. Safety will continue to be weighed against the need to gradually reopen. So there are 4 areas I want to briefly touch on: testing, contact tracing, isolation and quarantine, and PPE. For testing, we think we need to be testing between 2 and 3% of the population weekly with a positivity rate of less than 10%. The lower the positivity rate, obviously, the better. So we aren't quite there yet, but we are making progress. We took a major step in increasing testing in the county yesterday with opening up the Timonium Fairgrounds testing site to individuals who do not have a doctor's order. And there was a tremendous demand for that testing, as evidenced by the line of cars at the Timonium Fairgrounds yesterday. We have testing sites in Timonium, which is the fairgrounds, Randallstown, Dundalk, and Owings Mills. And so we're actively pursuing every option to increase testing in the county, both through the county's own efforts, through those 4 testing sites, and with partners in the private sector. The governor's decision this week to permit increased testing by pharmacies like CVS, Walgreens, Rite Aid, those types of businesses should help increase the county's testing totals as well. Contact tracing, according to current literature, we should be, we should have several hundred individuals able to perform contact tracing in the county. We're partnering with the state to meet that effort. There was an announcement at the state level yesterday about a call center partnership they formed to increase contact tracing capacity across the state, including in Baltimore County. The county is hiring for more than 60 contact tracing positions. So between what the state is providing and what the county is providing in terms of contact tracing, we hope to be in pretty good shape, but we are going to constantly look to expand that capacity even further with partnerships. We have a partnership with CCBC for individuals to sign up to receive training as contact tracers. So through partnerships like that, we hope to increase those totals and be where we need to be. Isolation and quarantine: as testing and tracing increase, we'll likely identify county residents that are unable to isolate or quarantine on their own for whatever reason, where we need to provide space for isolation and quarantine. This is especially the case for certain low-income households, those living in small spaces, among certain immigrant populations. So at this time, we've been able to identify a sufficient supply of housing for such vulnerable populations, but that's something that we're constantly tracking and evaluating as we move through this. And PPE, lastly, PPE, personal protective equipment. We're working to ensure there's an adequate supply wherever it's needed, specifically among our first responders, other essential workers, healthcare facilities, and in long-term care and assisted living facilities. We're closely tracking this. We're doing okay for now, but we need to maintain adequate levels throughout the reopening and recovery period. So it's something that we're constantly working on and looking to track and increase our supply. So in conclusion, these are the public health metrics that are going to continue to drive our decision making. We're making progress, but there's still a long way to go. As I'm sure everyone on the call knows, we're going to have to adjust to a new way of doing things. But the administration is committed to using the best available data that we've got to make decisions, and we will continue to strive to do the right thing, balancing the need to protect our residents with the need to get back to business. So that concludes it for me. Thank you, Will. Happy to answer questions.
Thank you, Drew, for giving all the detail, and Mr. County Executive Olszewski. I know you're both booked on other things. Please stay as long as you can, and if you need to jump out at any time, please do so. So we'll move on to our panelists, but I do say this in each of our webinars: working on the inside of this organization at such a time it's really an honor to be working with so many people who are working in a progressive, nonstop, 24/7 on behalf of the citizenry. And many people don't see how many people are really just doing everything they can to sustain while they're dealing with their own households and children. And but it's an honor to work inside this well-run organization and taking on these big challenges. I'd like to shift to the panel now that is really focused on a couple perspectives: public health, business logistics, and our county regulatory agencies. Our county attorney asked me to read our little limitations about the webinar, so I'll say this quickly in terms of advice. This is really, the webinar is provided to give general advice and doesn't constitute legal, financial, or professional advice. The views are expressed by third-party speakers are their own, not the county. Nor does participation of such a speaker constitute or imply the county's endorsement or recommendation of the business or organization with which the speaker represents. Baltimore County specifically disclaims any legal liability or responsibility for the accuracy, completeness, usefulness of any information, product, service, or process presented, and makes no representation that its use would not infringe upon privately owned rights. Furthermore, the presentation of any material or information by a third party regarding any specific opinion, commercial product, process, or service by trade name, trademark, manufacturer, or otherwise is for informational purposes and does not constitute or imply the county's endorsement or recommendation of such an opinion. So with that warm welcome to our panelists, I think the place to start, based on the county executive's remarks and Drew's remarks, is really on the public health side. That has never wavered from being the prime focal point throughout this pandemic, including on economic issues. So I'd like to start with Dr. Sohail Karni. If we could start with you. Dr. Karni is he is our Chief Communicable Disease Officer inside our Department of Health. And we're getting questions live from our audience, which is growing as we're talking. So if I could offer two questions generally that we're seeing, Dr. Karni, and ask you to react to these. One is really where are we in terms of cases that we're responding to, numbers, and then where are we going, right? So what is our forward-looking health strategy? Dr. Karni.
Thank you so much, Mr. Anderson. Thank you, Mr. County Executive, if you're still online, and thank you, the panelists, ladies and gentlemen. It's truly an honor and pleasure for me to represent Baltimore County Department of Health. And I bring greetings from our health officer, Dr. Gregory Branch, who, because of a prior engagement, is not able to join us. So very quickly, I will start by saying that I vividly remember a 7:30 evening call on March the 11th. And that was the call for our very first case of a coronavirus positive individual from Baltimore County. So going forward, a little over 2 months as of today, we have almost close to 5,200 cases for Baltimore County. And we also have, unfortunately, 271 deaths that related directly to the COVID-19. Having said that, we are still seeing new cases on an average for about 250 to 300 on a daily basis. Now, I know Mr. Vetter and County Executive has very eloquently pointed out that we have ramped up the testing as early as of yesterday. So just think about this. The CDC number is for each case that we diagnosed, there are about 2.5 contacts. So if you multiply that number, at least from 250 to 300, but then again, when we have these testing, the numbers that we are thinking of getting done so that the businesses and people can safely and be reassured when they come out after the testing that we are seeing a healthy population, both for economics and both from the perspective of the population, that number will only going to continue to grow. Having said that, the CDC had just came out with an estimate yesterday that about 35% of the US population has the illness and does not know it. So these folks are otherwise healthy, but have the virus. So they have the ability to transmit, and that is exactly what we are now into the phase or the strategy going forward to come down to the positivity rate that the county executive has alluded to. We need more testing that will equal more tracking, that will then equal more isolation, more quarantine, and obviously more PPEs. But having said that, that will also give us an opportunity for the businesses, for the folks to go in and out of those businesses to think that they are safe and they're in an environment which is when other people possibly have tested, and they can then go and enjoy the life as we used to know prior to March 11th for Baltimore County. So having said that, so I just have a very, very quick overview of what is the strategy that we are, or guidance that we can provide in general terms. These are not specific to a particular business. So I have sort of divided that into what the folks need to know about getting their staff back into the business or the facility. So I would start out by saying, first and foremost, the identifying the high risk or the vulnerable employees, and those will be ages 60 to 65 with underlying illnesses, having heart issues, diabetes, hypertension, or any other immune compromised issues that they may be having. So those folks, if possible, may have to work in an area which is not exposed to a lot of traffic and a lot of customers, and or possibly if they can be allowed to work remotely. And that also brings up the point that, and it has been said over and over again, to have some policies in place where you can excuse these individuals to work from settings that are less likely to expose them. And the second bigger issue is daily screening. And what that basically means that when the employees get to your facility, that they should be asked some very simple, quick questions, whether or not they are feeling well that day, with cough, fever, shortness of breath, muscle aches, or any symptom. And also if they have been in contact with a person with a COVID positive illness, and or if they have been tested positive within the last 14 days. So having those answered, one other question that comes up, and we've gotten a few calls, that's to the temperature. If somebody tells you that they are febrile or they don't have a fever, is that acceptable? And that is, again, a situation that you'll have to decide whether or not you would like to get the physical temperature taken, as opposed to accepting the statement made by the person coming in. So once they are in, there are just a very few things that still goes a long way. And we have seen that in our private gatherings, and also applies here with having a mask on if permitted. or if allowable, and also if it does not, obviously comes into the way of the working. So masks can be provided, or they bring their own mask. Hand washing stations and sanitizers, barrier between staff and customers. Ideally, one-way traffic for people to keeping the social distancing with signs and marks that say 6 feet, reminders of one-way traffic. So there are some of the basic things and the guidance that can be in place when we are ready to open up. Now, on the flip side of this, the folks who are coming in to your facility, and these I'm now talking about the customers. So particularly if you have a service that actually works on appointment or reservation basis, there can be a simple screening done when the reservation is being made or the appointment is being made by asking again the same question about their symptoms, if they have any fever, or if they have been in touch with a person with the disease and so forth. Obviously limiting the number of customers as we stand right now, it happens to be 10 or less, but I'm sure that will change. But again, limiting service. And one last thing that I cannot overemphasize, and I know somebody will follow up with that, increasing cleaning and disinfecting frequency. And most people think cleaning and disinfecting is the same thing. They are not interchangeable. Cleaning is cleaning and disinfecting is actually getting rid of the virus and the bacteria. So these are some very general guidelines. And in summary, in the absence of a cure, vaccine, and treatment, social distancing, masking, hand washing actually is the only way to prevent that. And one piece of advice that most places are doing it already, but put this on your website, on the social media, the kind of things that you have undertaken it to your facility to make it safe for people to come in, advertise it, have the policies in place so you can tell people that this is what you do. And one last thing, and this is really the last thing, we do have a COVID hotline through Baltimore County that operates 7 days a week from 8:30 a.m. to 5 p.m. And you can call that number at 410-887-3816. Again, 410-887-3816. And I yield back to Mr. Anderson. Thank you again.
Thank you, Dr. Carney. That, I think that is really helpful when you drill down into specifics. We know our business owners and their workers are dealing with so many things. The more specific we can get to give them a checklist of what to do and not have to do interpretation, I think, as you just did, about who do you focus on, what do you ask them, how do you screen them, that was very helpful. And we're really grateful as well to have another public health expert with us today. And Lucia Mullen is the lead author of the Johns Hopkins Center for Health Security and the newly released operational toolkit, which really folds nicely into what you were saying, Dr. Carney. Here is very specific directions for businesses that is ready-made and gives you help on reopening and expanding. And Lucia, I've got two questions for you, but as we're talking, I'm looking at the questions that are coming into Todd, and a lot of them are coming about specifics about, do you recommend masks? What can we do to protect our instructors in a driving school? So I think that the general question I'd like to ask you is, one, now that we're opening and moving into phased reopenings, what is it that businesses should be doing when they go into your toolkit? What will they find? And more specifically, if you can even speak to shifts, do shorter shifts help less than exposure, or longer shifts, is that preferred? So if you could kind of speak to what people will find in their toolkit, I think that would be really appreciated by the audience.
Of course. Thank you, Mr. Anderson, and thank you to Mr. County Executive for having me. So it is really important for businesses to take a step back and assess their vulnerabilities and exposure opportunities in order to understand their risk and how to reduce this before they open. That way they can react ahead of time rather than in this reactionary manner. We'd heard that a lot of businesses were very uncertain on where to begin, and we'd received some requests. So that's why we actually developed this toolkit. And it's intended to be a starting point for businesses to identify their risk of transmission of COVID-19 and provide them ways to reduce this risk. So there are three parts to this toolkit. You have the instruction manual, the business risk worksheet, and the assessment calculator. You're supposed to use all three in conjunction. The instruction manual, as it states, is really just a very detailed list of instructions that provide businesses with a stepwise approach to work their way through it. The business risk worksheet is a workbook that they can fill out with their answers depending on what they get in each section and how they've answered the questions we've posed. And the assessment calculator is actually an Excel spreadsheet where they will fill out, this is where our questions are for the risk assessment and the modification assessment. And I'll explain those two in a bit more detail in a second. And they will receive scores from this. It's already pre-calculated and pre-weighted for them. So there are 4 phases to this toolkit for the businesses, and it walks them through how they identify their risks. So the first is the risk assessment, and this focuses on the opportunities of exposure a business may have. We've been speaking about that a little bit already. So we know that there are 2 types of transmission opportunities. You have human to human, which is person to person spread, or object to human. And this is from touching things that have been infected with the virus and then touching yourself, your mouth, your eyes, etc. We also tried to ask questions that focused on the quality of interactions. So just passing someone on the street is going to be a lot different risk than businesses that may have to touch their clients, whether that's a masseuse or a dentist, or businesses that have to have very extended periods of interaction in close contact with these clients. So we're trying to differentiate out between those in order for businesses to understand where they have their risks, what are their operations that are considered most vulnerable. So businesses answered these in their business's normal operations, that is, how they acted prior to this pandemic. After that, you do the modification assessment, which again is a series of questions that ask what can be changed about these operations, what can they do to reduce these risks. So examples here might include moving their business entirely online, which is what we've been seeing currently, or limiting the number of people interacting at any given point. So again, as we've spoken about, some restaurants are considering achieving this by moving to outdoor settings or even restricting the number of people allowed in their restaurant at any given time. The retail industry have limited the number of people interacting by limited face-to-face contact and using online buying with delivery or pickup options only. After these, the toolkit shows how the 2 scores, your risk score and your modification score, interact in order to receive your overall score, which is what we've designated as your current risk of spreading significantly to COVID-19 transmission in the community should you open right now. And this is intended as well to not just be considered right now, but as we move through these phases, and obviously our risk increases, but as we move through the phases and hopefully we get to a situation where we have less community transmission, we can consider activities that would have greater risk at that time. So this helps you kind of move through that as well. Finally, we end with what we're considering mitigation measures. And so with this, there are, this is a list of, or a checklist really, in a number of different tables of measures that businesses should consider adopting when developing their specific risk mitigation strategies. So these include a variety of different ones, such as physical distancing measures, such as establishing alternative shifts, as you have just mentioned. So it depends on this again. A lot of companies are considering shorter shifts, which means there's less opportunity for interaction, and there's more opportunity on the backside of it to enable proper cleaning and disinfecting of the rooms. Others have actually gone in different countries to longer shifts so that they can ensure that less people are interacting at a given time. So you have to decide what is your objective, and that helps you decide whether you want a shorter shift or a longer shift. Also with it, what a lot of businesses have been considering doing is moving their employees to shift work. So the same employees will work on a shift at all times rather than having different employees interact with each other. That just, again, limits the number of interactions a person may have, which will, again, reduce their risk. Other options look at infection prevention and control measures, as well as what we call WASH, which is water, sanitation, and hygiene measures. So here is where we're looking more at the cleaning and disinfecting side that has already been discussed. And certain considerations that we ask is, are businesses considering requesting an increase in supplies from manufacturers? As we are cleaning and disinfecting a lot more, we're going to be going through these supplies a lot quicker, and we need to make sure that we have them in the supply chain without that breaking down. Some other measures you might include in here would be procuring masks and other necessary personal protective equipment for employees, or developing detailed cleaning schedules with quality assurance checks and training for the employees, as it is very important that this is done properly and effectively. So
Chief, I think I do need to ask you to conclude so that I can get to the other panelists, and then and if you could end by mentioning where folks can find it. I know we're going to post this on the county's website, but if we could ask you to conclude so I can move on a little bit through the panel, please.
of course. So yes, while all these measures may not be relevant or possible for businesses to implement, they should be able to pick and choose what they can. And so we hope this toolkit will be valuable for them to act as a starting point in order to safely reopen. And this can be found on the Johns Hopkins Center for Health Security website. We have a COVID-19 specific page with all of our guidances and tools.
Wonderful. Hopkins has been out in front on COVID globally, and we really appreciate the work you did in this toolkit to help our businesses. And I think, you know, what you're describing there about the workbook and the assessments, this is stuff that we're doing in the county as a large employer ourselves, dealing with people. And the mitigation efforts leads really nicely into what Brian Sansoni and the American Cleaning Institute are all about. So I'd love to just sort of jump from what you were speaking there and ask Brian to fill in a little bit of details. Forgive me that I'm only going to be able to have folks talk for two minutes so we can get to everybody. But Brian, really, I think some of the specifics that people are going to be asking really are about, you know, how often do we need to disinfect, what surfaces, which bathrooms, is regular hand washing with soap the way to go, or should we be doing spray disinfectants? What can you give to our audience here on the really on the disinfecting side?
Yeah, it's and I realize we have a number of different types of businesses, different size businesses that are probably tuned in today. You do want to be cleaning and disinfecting several times a day at your business, particularly around the hot spots. What that might they be? Keyboards, light switches, faucets, equipment handles, the appliance handles in your staff workroom or break room. So what is everyone touching a lot? Also important, as you want your customers to have a comfort level. It's really important that you have more than ever hand sanitizers or hand sanitizer stations available in your business if at all possible. Or they might see disinfecting wipes, or that the staff is regularly cleaning. There was a survey read earlier this week from the group Morning Consult, asking about what will it take for people to feel comfortable to come back to businesses. 81% of consumers said habitually cleaning high traffic surfaces would make them feel more comfortable. More than 3/4 has said that making hand sanitizers more available would make them feel comfortable. So really, it's about cleaning and hygiene. It's about a comfort level. And as businesses open up and we can welcome them back, and guests in hotels and restaurants. Let me, one other point for the hospitality industry. I read a great story in the New York Times this week. Basically, cleanliness and hygiene is the new 5-star hotel. I mean, that represents a premium. So people seeing that, you can tell them what you're going to do, but they need to see it. So just having those products available, making sure your staff is trained if there's some in-depth cleaning involved, and make sure those products are used as directed. And if there's cleaning chemicals around, make sure they're stored safely as well. So those are just some very good reminders as we get back to business.
That's terrific, Brian. Thank you. And you know, one of the really nice things about what you just said there, these are things we can do. There's so many things that are unknown that we can't do, that we don't know how to do, that we're counting on an expert. What you just rolled out is activity that we know works and makes our customers feel better. 81% is quite a number. So thank you. I'd like to shift from the public health and the mitigation side over to really, you know, the ground level perspective of business, because we have representation here of very large businesses and small businesses, and then what we're trying to do here in the county to cover the whole waterfront. Emily, I'm going to shift to you. Emily Brophy, Senior General Manager at Towson Town Center. You know, Brian talked about covering all the hot spots. When I think about your big properties at Towson Town and White Marsh Mall, that's a lot of spaces to be dealing with disinfectants. How are you covering large areas and, both large and small, and putting these kind of recommendations into place? And if you could frame it for other businesses too, who are out there who are not nearly as far along as you and some of your tenants are.
Sure. Thanks, Will. I appreciate it. I mean, a lot of what the panelists just mentioned is are items that we've already prepared and are preparing for. Right now, we have over 150 businesses in Towson, and that ranges from local small businesses, sole proprietors, all the way up to people like Nordstrom and Starbucks. So similar to what you mentioned, I mean, Nordstrom and Starbucks, they're going to have their own reopening processes in place with their corporate teams. But for us, getting the common area ready, which is about 1 million square feet across 4 stories, we're putting a lot of those suggestions that Dr. Carney, Lucia, and Brian had mentioned. I mean, we have a plethora of signage. I mean, when Brian's talking about reminding people, I mean, I hope you can't walk 10 feet in my mall once we open without seeing a sign somewhere that says, shop with space, please stay 6 feet apart. We have hand sanitizer at every single entrance. We've limited our seating within the food court and throughout the common area. We've actually, we're planning on keeping some amenities closed, certain places like the play area, valet services, drinking fountains, just some of those hot spots that Lucia had mentioned. Until the public is comfortable and we're comfortable reopening those, some of those things will remain closed. We've got day 1 welcome bags for our retailers. So totally aware that PPE is super difficult to get right now. We're actually providing some PPE and some candy treats and things like that just to welcome all our businesses back. We are going to be offering complimentary PPE to customers for the first couple of days when we reopen. I think our biggest push, being a huge public place, is just we really want to welcome the community and retailers back, but we want to make sure they're happy and comfortable being there. You are going to see our housekeeping team everywhere. Talking about the frequency, I mean, the entrances, the restrooms, all of those hot spots will be touched basically every hour with certain disinfectants. And we're really just focusing on that intensity and the frequency and all of those places. And just kind of bringing everybody back. I mean, we've been able to, at this week, thanks to Drew and his team, actually open some of our inline retailers for curbside. So that's allowed some of our retailers time to ramp up. And then we've got that phase reopening plan as well, prepared for limited occupancy and full operations.
Great, thanks, Emily. I know we asked you to cover a lot in a short amount of time, but thanks for everything you guys are doing at our malls. It's important. Our malls are big places, a lot of people, very difficult. So thank you for sharing that. I'd like to zone in even, we're kind of drilling down a little bit. I'm going to ask Brian Boston to speak to a couple issues about our restaurants in general, his own restaurant at Milton Inn, but actually, when you're looking at these guidelines that are coming from CDC and they're coming from Hopkins and they're coming from your own Restaurant Association of Maryland, Brian, how do you translate these requirements into a welcoming hospitality where we can have our customers want to come back even while you're in limited service? And how are our restaurants faring in Baltimore County in general?
Thank you, Will. Thank you, County Executive, and thank you everyone on the call. Restaurants are desperate to get back to work. We are all going through a lot of pain at this time. A lot of us, 25% of all restaurants have closed already for good in Maryland and around the country. Every day that passes without us opening, more restaurants are closing as we speak. Keep in mind that the Restaurant Association of Maryland represents over 11,000 restaurants and 250,000 employees in the state of Maryland. It's over $14 billion industry in our state. So it's very important that we get back to work as soon as possible in a safe way. Keep in mind that the dining experience starts when people make a reservation. And this is a great time to give a brief but important overview of not only what your restaurant is doing as far as preventive measures, but what you will expect from your guest upon entering your establishment. Give your staff as many tools as possible, such as a script for how to take a reservation post-COVID-19, and answers to frequently asked questions. Reinforce with your staff that they're in the hospitality business and to be as gracious as possible with the guests, because people coming in are in fear as well. You may have some staff members that are in fear for working. At the Milton Inn, we are using a product called C19. It's a surface protectant by Safe Grip. It kills 99% of bacteria on contact, including E. coli, Staphylococcus, and COVID-19. It's non-toxic. It's a disinfectant. It lasts up to 10 days in high traffic areas and 15 days in low traffic areas. That's just a supplement on top of what we are already doing. Restaurants have strict health guidelines. We always have. They're very clean places, and we keep people safe from illness all the time. That is what we do in our business. Instead of taking reservations every 30 minutes at the Milton Inn, we are now taking them every 5 minutes. So we can spread out the patrons from arriving all at the same time. So we can get people to their table. The next set of people come in, we can take them to their table in an orderly fashion. Our staff is required to wear their masks and use one-use gloves when serving food and beverage. Our guests will be asked to wear masks until they are seated, and they will be asked to put their mask back on if they get up for any reason to go to the bathroom or when they're leaving. We have also put into place several other preventative measures, such as one-use menus, hand sanitizing stations, social and physical distancing, employee health monitoring on a daily basis, as well as taking temperatures of guests as they enter our building. Reservations will be mandatory for the foreseeable future for us. This will assist in controlling how many patrons are coming through the door at once. Guests may give pushback. My best advice is to train your staff to be polite but firm with the rules of the house, and let guests know that your restaurant is looking out for everyone's best interest, including their own. If you and your staff give off professional demeanor with a dash of levity and look as if you're in control and confident, it will go a long way to help patrons become comfortable eating out again. Thank you for your time.
Thank you, Brian. That's, I'm reminded each time we're in a conversation with you in the Restaurant Association, we really appreciate your leadership on this, but just how vital our independent restaurants are. I mean, they are at the heart of our communities. They employ our citizens. They are a supply chain. They are tied into everything, and they are very fragile businesses by nature. So I'm reminded about a couple of years ago in the unrest in the city when our city colleagues, the restaurants took such a hit when people were not coming to the restaurants, and we really needed people to get back in there. And it's going to be difficult for patrons to come back in, but we really need patrons to get back into our restaurants. They are clean. They're going to be safe. It's what you guys do, and we really appreciate the way you're implementing these. I'd like to jump into Kelly and then on to Mike about what the county is doing. But Kelly, I mean, you've got a cool place in Grind and Wine yourself as a restaurateur, but you also as the executive director of Liberty Road Business Association, you know what's going on the small town retailers. And I wonder if you can speak to what we're talking about here on reopening and what's happening with small town retailers.
I think a majority of the small town retailers are anxious to get back to work. A lot of us are working with slim budgets, causing us to be more creative than usual to market to customers. Communication is vital. I know our membership is very grateful for everything the county is doing to look out for small businesses, local businesses. Most of us on the main street are in revitalization districts or sustainable communities. So it's tough, speaking personally from a restaurant owner who now is operating off of 42% of the revenues coming in. My staff was originally 23. I'm down to 7, including myself. So throughout this, I've learned to be creative and wear multiple hats. it's really important that our employees who are currently working with us, and as for all small businesses, that they're able to communicate any anxieties or concerns. We do the routine cleaning, etiquettes as far as coughing, sneezing, washing hands. I think you all, the panelists, did a great job in covering everything that we need to do. But we just have to have these conversations more and more. I think as small businesses versus large businesses, we're working harder to keep our doors open. But I think we also have a special niche of, we're already doing the groundwork. We're already doing more hands-on, where we don't have hundreds of employees we have to lay off. We're just doing longer shifts. And again, communication is key. Will, you do such a great job with resources. The county has not skipped a beat, although they're doing telework. The service that you still get would be as if everyone is in the office working. So I commend you guys for a great job. Well done. But again, I still think the key is communications in the county and state providing us resources that we can actually utilize. So you guys have done a great job with that. Thank you.
Thank you. I think you're making a big point that leads really nicely into Mike about communication and etiquette. You know, we were looking at some of the research of what's happening around the country in other areas, and one of the reminders that Alan Kobler found is people are talking about how, you know, you'll need to protect your reputations in this scenario, because your patrons and your employees will be recording and sharing the experiences that are happening in their spaces. So when you talk about communication and adhering to the rules and etiquette at the same time, you need to know that you're kind of on display in that regard, and that makes it even tougher. So I'm going to I want to jump on to Mike, because Mike is really spearheading a group that's fielding a lot of the questions that we're seeing coming in here. Mike, I'm going to throw you. Mike Mueller is our chief administrator of our liquor board. I'm going to throw you one little softball, and then I'm going to ask you a harder question. Here's a question that came in from Clyde. Can restaurants legally do curbside pickup for food?
The short answer, they can do curbside with any product, you know, their food and their drink product. The only thing we require is that the drink would have a lid on it, and we strongly suggest that lid also has some type of tape on it. But if the question is, can they do drinks? Yes, they can.
I think what that speaks to is there is a lot of confusion between state guidance, which the county cannot ease restrictions that the state applies. That's why we're closely trying to follow everything the state mandates. We can make things more restrictive, but not less restrictive. So I wanted to start with that question, Mike, because it causes, this has been the case that people can do curbside for some time in the county, and it causes confusion when people have to look at different guidelines. But let me ask you, we're going to run over by a few minutes here. We started a little bit late, but I wanted to ask you to talk about the approach that the county is taking right now in permits and approval. I know Drew has stood up with the county executive a multi agency work group to figure out how we help get people open fast but safe, working with the restaurants and bars and Brian and some of the other folks on the call here. Can you share with people what the county is doing and what everyone can expect?
Absolutely, Drew, and I'll be very brief. First of all, excuse the COVID hair, but I'm sure I'm not alone in that. I'd like to be positive first. We have conducted our first liquor board hearing in about 10 weeks since COVID all began. Not as business normal, but it's as business as the new normal. And we will now be running our weekly hearings and getting back on track. So that's all positive. Excuse me. As you said, I'm co-chairing a restaurant fast track task force, crosses multi-agencies. We're preparing and trying to prepare our restaurateurs and all of our restaurateurs, alcohol and not for the if, but for the when restaurants will be allowed to open for outside dining. We are all waiting for the governor. Right now, none of us, I do not believe, have any indication when that will come, but we want to be ready and we're preparing for it. That group involves the liquor, health, building, zoning, police, fire, law, and DPW, Department of Public Works, as needed if there are requests for street closures and such. The process, number one, we'll be having a packet outlining all the safety guidelines that have been talked about today. It'll involve the use permit, require a handwritten site plan. We're not asking you to do architectural drawings. If you need a tent, tent permits. If changes are going to happen in your menu, or if you have new plans to use outside grills, that will need health department approval. We will be email based. Applications to come in. Our very aggressive goal is to get these approvals out day of, certainly within 24 hours, and max of no more than 48 hours. We will have this package out very soon. We want safe openings. I was so glad to hear Brian talk about reservations. We are strongly going to urge everyone do business by reservation. Sorry for that phone ring.
I think that's it. I think that was a great conclusion. I mean, we've had a bunch of questions come in. I've been trying to weave them in for folks. I want to remind people they can send those questions in on an ongoing basis to a dedicated email account we have called businesshelp@baltimorecountymd.gov, or you can just go to our website, baltimorecountybusiness.com, and you'll find the grant that Drew was talking about and all these resources that Mike and his team are starting to bring together. I'm sorry we ran over. We had a very big panel and tried to cover a lot of territory here. I want to thank you all. We're going to be sharing the resources. I'd like to ask Drew Vetter if you'd like to kind of give us our last word as you and the county executive pulled this group together. Drew?
Yeah, thank you, Will. Thank you to everybody that listened today. I hope that you found the information that was provided helpful and meaningful. But certainly there are avenues to follow up on anything that was not addressed on the call by using the email address that Will provided. We'll be certain to follow up on all of the questions that were asked. This webinar was recorded and will be posted on the county's website as well, so you can refer back to it and refer others to it. I want to thank the panelists for making the time to be on this today and providing very practical, actionable recommendations and advice. Certainly this is not an easy time for the county and certainly not for the business community. But Will, I want to thank you for the department pulling together this panel and just providing information to make it a little bit easier. So with that, I hope everyone has a wonderful Memorial Day weekend and that you continue to be safe and healthy.
Thank you, Drew. And thanks to the group behind the scenes here, Courtney Brown and Todd Dolbin, Ellen Kobler and Kristen King that pulled the thing together. Thank you all. I know you got to get on to your busy days, but we really appreciate it. And everyone stay safe. Take care.